Let's turn to spending. You would cut Medicaid and other health programs by $770 billion more than the president's budget over 10 years. You would cut entitlements like welfare, food stamps, and agriculture subsidies by $2 trillion over the next 10 years. The White House says you look at that and that you are putting the burden for balancing the budget on the backs of the poor.
Couple of things. Number one, these programs still grow. Number two, right now they're growing at unsustainable rates. We've seen a 400% increase in the food stamp program, and that doesn't even account for the recession. The other point I would make is this. Is your job or goal to treat the symptoms of poverty to make it easier to live with, or is the goal to eradicate poverty by treating the root causes? What we want to do is have welfare reform that gets people off of lives of dependency and onto lives of self-sufficiency. That's why we couple this with job training programs and work requirements. We think we ought to make sure that we get people out of the cycle of poverty. And unfortunately, I think the plan that we have in place, the president's agenda, creates more of a dependent culture, creates people that are more stuck in poverty because it denies the idea of upward mobility. And so to me, this is a critical difference about repairing the safety net and making it a system that gets people back on their feet. And that's what we're trying to do.
I can understand that when it comes to welfare and food stamps, that you're saying you don't want to continue the cycle of poverty. What about something like Medicaid? People get sick.
People get sick, but Medicaid's already going bankrupt. Medicaid is already a program that so many doctors won't even take anymore because of its federal rules, regulations, and mandates. So we're saying let's block grant Medicaid back to the states, allow states to customize this benefit to meet the particular needs of their populations. And yes, it will still grow under the program that we're talking about, but we will free the states to experiment and make sure that they can customize this benefit to the needs of their populations.
I want to pick up on that because you and all of the presidential candidates are saying, let's take Medicaid and a lot of these other programs, turn them into block grants and give them to the states. But there was a new study that just came out, and I want to put it up on the screen. This was a study of the way that state governments do business. 19 of the states got a C, 18 got a D, 8 got an F. There was not a single A. And look, I mean, I've been around, I've covered state politics. What makes you think states are going to be any better, any more efficient, any less corrupt in doing this than the federal government?
All the answers don't lie in Washington. The genius of America does not lie in our bureaucracies in Washington, but government closer to you is government more responsive to you. We believe in the principle of government by consent of the governed, and we believe that innovative reforms, like welfare reform in the 90s. Tommy Thompson was the trailblazer of this in Wisconsin, and we made it very successful. So we think we should return, with the 10th Amendment, responsibility to the states of these issues so that state government, which is closer to the people who are involved in these programs, can be held accountable and can customize these solutions. It's a diverse country. You know, the problems they have in New York State aren't exactly the same problems we have in Wisconsin, so we shouldn't have all these federal rules and regulations that treat us the same with cookie-cutter mandates.
Then there's Medicare, and as you predicted when you announced your budget, Democrats, and you heard it again today from David Plouffe, are hammering you saying you're going to destroy Medicare. Take a look.
We'd be so much better off as a country if we spent a lot less time and energy fighting off these efforts to dismantle Medicare. And I mean dismantle it.
The Congressional Budget Office says under your plan by 2030, average government spending on each new Medicare enrollee would be $2,000 less than the status quo. Wouldn't you, just factually, wouldn't you make seniors pay more for Medicare and their health care than they do now?
Those same numbers apply to the President Obama's health care law. Medicare grows at the same rate under our budget as it does under Obamacare. Here is the key critical difference. The president's health care law puts 15 bureaucrats in charge of Medicare. We put 50 million seniors in charge of their Medicare. He is putting these bureaucrats, unelected, unaccountable, in charge of price controlling, which leads to denied care for seniors. We're saying get rid of the health care law, stop putting this rationing board in charge of current seniors' health care, give them the guaranteed benefit that they organize their lives around. Don't change their benefits for anyone in and near retirement. But in order to make good on that promise, which is becoming a broken promise under the status quo, you have to reform it for the next generation. And there's a bipartisan consensus on how best to reform it, and that's what we include in our bill. We save and strengthen the program. The current law makes it go bankrupt and puts this board of 15 bureaucrats in charge of price controlling, which will lead to denied care for current seniors.